Place the patient in the prone position. Use X-ray-based imaging throughout the procedure. Adjust imaging until a true lateral view is achieved by superimposing the alar lines and mark the alar line on the patient's skin. Mark the posterior sacral wall location on the patient's skin for reference and make a 3 cm incision aligned to the true lateral view of the posterior cortex of the sacrum, starting approximately 1 cm from the alar line, progressing inferiorly about 3 cm. Center the Steinmann pin halfway between the anterior cortex of the sacrum and the anterior border of the spinal canal, at least 1 cm distal to the alar line, as visualized on the lateral fluoroscopic image. Advance the Steinmann pin to the desired depth using imaging. Insert dilator number 1 gauge over the Steinmann pin and down to the ilium. Notate the size indicated by reading the gauge at the proximal end of the Steinmann pin. Insert dilator number 2 and dilator number 3 to the ilium and attach the dilator handle to dilator number 3. Remove dilators number 1 and number 2. Guide the drill over the Steinmann pin. Drill slowly into the ilium until the desired depth is achieved. The drill depth is indicated on the proximal end of the drill. Load the correlated size implant onto the screwdriver and deliver over the Steinmann pin. Slowly drive in the implant until seated. Once the indicator is in line with the proximal end of the dilator, the implant is seated. Confirm the implant is properly seated. Remove the instruments, leaving the Steinmann pin in place. Use the fixed guide for positioning additional implants. Position the fixed guide as desired and insert a second Steinmann pin into bone through the additional cannula. Remove the fixed guide and drive the Steinmann pin into the ilium as detailed in Step 3. Repeat for placing additional implants. Finally, guide the bone funnel over the Steinmann pin to the implant. Remove the Steinmann pin. Place bone material into the funnel and use the bone funnel tamp to press the bone material into the implant. Repeat for each implant.